The lecture itself is named after Archibald Goodall, and this is the first time I've managed to do this as honorary librarian. His picture is up here in our library. He was a previous honorary librarian and unfortunately died at the age of 48 in 1963. And barring COVID, there's been an annual event named after him at the college since 1965. He was an amazing medical historian, and as well as a surgeon, and he had lots of publications around medical history, including some research on some of our fellows and members and past presidents. So Robert Watt was one of them that some people might know, and Peter Lowe, our founder. Tonight's lecture, though, is part of an exhibition that we have when you were down in the Crush Hall earlier on. I'm sure you saw the big wall at the back, and that had some of the Thomas Annan photographs on it. But our exhibition is Vaccination Finding the Perfect Disease. And the Annan Studios also took some photographs of our second faculty hall, which was in the exhibition too. You can see that at the entrance, and as well as some other portraiture that we have in the college. As honorary librarian, though, with a long-standing love of books in all shapes and sizes, on a more personal note, I'm going to talk about Annan, because I remember a copy of his book in my house, and I have it here tonight. I'm just going to show you it. So this is my edition of the Thomas Annan book that we're going to talk about. And I always remember as a child looking through, seeing the childlike ghosts that you could see. And I think at one point I thought, he took photographs of ghosts. So I'm going to actually say this. When I was very small, I was like, that's a bit scary. But also the amazing focus of some of the other people as well who are featured in the photographs. And also the deprivation in Glasgow. And that's what we're going to hear about. The same photograph, though this photograph here, which features, is also in another book of mine I quite like, which is about J.B. Russell, who was the first full-time medical health officer in Glasgow, and also a member of the Heritage Committee, as well as a member of the college. So that's the same photograph there. Our college copy, though, of Annan's Old Glasgow was gifted to us from the Glasgow Corporation by John Muir, who was the Lord Provost at the time, to our then President, Robert Scott Orr. We've got a letter in our collection that's actually in the book. So the book's too big to have here, and it's locked away in our collections for safekeeping. But the letter is dated from the 9th of September 1881, and it says, "I have now the honour to ask, through you, the faculty's acceptance of a volume that more than any other memento of Old Glasgow will remind them in the future years of the beneficial change that has been wrought in sanitary and social respects by the operations of the Town Council as improvement trustees." Earlier still, though, than that, 1881, William Nimmo, who was a member of this college, which was the then faculty as it was called, was the first medical man to inoculate with cowpox on the 30th of May 1799. He inoculated a child of another faculty member called Thomas Garnett. I think at the time this was thought to be a great advert for vaccination and hopefully played a part in reassuring the public that we were vaccinating our children. Although hopefully it won't go as wrong as other people that have done that in the near past. But onto our speaker though tonight, I've waffled on enough. Tonight we're really lucky to have Simon Walker, who is a Senior Research Associate at the University of Glasgow in the School of Health and Wellbeing, and also part of the Healthy Working Lives group. He has several publications in the field of suicide and mental health, military history, race and post-colonial history, medicine and public health, and cultural hybridisation. I'm really looking forward to this talk and the discussion afterwards. So without further ado, I'm going to hand over to Simon to take it from here.
So I'm going to talk to you very much just a little bit about me, because I'm a megalomaniac, and then I'm going to talk to you about Thomas Annan. The problem was with this talk was when Ross contacted me and said, would you give us a talk? He wasn't very specific. So I had fun. So as a medical historian, at the heart of it, I've enjoyed myself, and we've covered quite a lot of ground here, so there will not be any breaks for you. But we're going to have a look at Thomas Annan. We're going to look at what he did, who he was. We're going to look at Glasgow and some of the new approaches in modern science. Then we'll have a bit of a whinge about anti-vaccination, and then we'll come to the end. Okay? So the big question is on everybody's lips is why me? I can see at least 4 people in the audience who know more about this than I do, which is not intimidating at all. But essentially, Ross told me as we came up the stairs, it's because I answered my email. So You get what you pay for. How much am I getting paid? Right, so I'm a medical military historian. That's what I trained as. But I'm now a senior occupational health researcher because my director, who is also in the audience, promoted me as a joke on Monday, and I'm taking it. So, and I'm now a historical suicidologist as well because I look at occupational health research and with an incorporation of suicide. But I'm pretty boring. I'm going to skip past me. I just wanted to present my bona fides, so you know I'm not just talking absolute nonsense. So, the man himself, Thomas Annan. By now, everybody knows he was a Scottish photographer. If you don't, you're in the wrong talk. And you're aware that he did images of old, dilapidated buildings and the narrow streets of Scotland during the 19th century. In many ways, it's a bit of a crime that this is all he's really remembered for, because Thomas Annan was an incredible man. He was an incredible inventor in many ways. He created new methods of photography, which I'll talk very briefly about. But a great honor is he's probably the first social photographer. He went out into the streets of Glasgow with a camera more or less the size of a small Labrador and tried to take pictures. Don't know why I used the Labrador thing. But he's remembered because of these closes and streets of Glasgow. And you can see as the images go around, all of these images are his, usually taken around from about 1860 onwards. Got a look at his life. Born in Fife. Anybody representing Fife tonight? It's a terrible place. Anyway, I don't know, never been. He opened a photography studio in 1857, and on his 16th year, in 1845, he became an apprentice lithographic. Am I saying that right? Anybody who knows better? Lithographic, is that all right? Cracking. It's like an exam that marks you back. An engraver for the local newspaper, and he actually completed his internship in about 2 to 3 years. He should have done it in 7. But he's very, very gifted. And he moved forward and he developed skills while working for Joseph Swan. And you can see in 1849, he starts working for Joseph Swan, who was at that point a lithographic writer. And then in 1855, he sets up his own company as a calotypist. But what we're missing here is in the 1850s and 60s is there is a huge shift in the technology of image taking. Bear in mind that technology tends to be limited to 2 factors. One, it has to be limited to discovery, and it also has to be limited to cost. So at this point, you get photographs of people in the 1830s, it's the 1840s is still very stilted, they're a bit blurred, the technology isn't there yet, and it's for the very, very rich. But gentlemen such as Thomas Annan, we're discovering new ways of developing film, using film, reusing, and in playing with light, which sounds like an odd thing to say out loud. In 1855, he sets up his own company, and in 1859, he founded a photographic printing works in Hamilton. Anybody from Hamilton? Yeah? You'll know that's the best thing in Hamilton. Yep. Used to live there. Not anymore, thank God. 1860, and then Annan then creates a large-scale camera works, which begin to not only reproduce photographs in better detail, but they begin to reproduce them and make them a little bit more cost-effective. And that's where we get the innovation from. By this point, he's getting to be known as a real kind of pioneer in his field. He makes a reputation for himself as an expert in copying works of art. And he then gets commissioned in 1862 by the Glasgow Art Union. In 1865, he wins the Best Landscape in Scotland award. And then again, in 1866 to 1868, we get the point that we're going to really talk about today. He starts to take his camera into the streets of Glasgow, predominantly around kind of the Salt Market area, and starts to take pictures. I am going to mention, but I'm not going to talk about it a lot, is that in 1887 he died by suicide, which is a strange thing to say, but I was very excited to find out about because it's in my field. And I didn't realise that, and I've spoken on Thomas Annan before, so I don't know whether that makes me a bad researcher or not, but The fact that he died by suicide, and the interesting thing about it is that we don't know why. In many cases, you'll find in suicidology that you don't know why, but the reports are sketchy. His business was booming and he was the pioneer in his field, and yet still he completes in 1887. It's one of those mysteries that we haven't fully solved yet, which is kind of wonderful in a way if you're into that kind of thing. So you'll see here that this is not Thomas Annam. Has anyone noticed that? Does anybody know who this is? Yeah. So this is Ernest Archibald Taylor. He was a Scottish artist, oil painter, watercolourist and etcher, quite famous, but not obviously famous enough to have crossed your path. The reason he's here is because of all of the Thomas Annam pictures, this is one that stood out of me, and it wasn't even taken by Thomas Annam. This was taken by one of his sons. This was taken, we gather, probably around about between 1920 and 1940. So why am I showing it to you? Because I wanted you to just note, just briefly, the quality of that image. And I wanted to compare it to something I did with a modern device. I mean, look at him there. I mean, that's a handsome chap. Right? Even with the zoom in. The point here was that I used a phone to take a 4K selfie and then zoomed in to look at the quality. And I just couldn't believe the level of quality that we were getting from photography 80 years ago, built on the new photographic methods that Thomas Annam himself designed. So I just thought it was really interesting and wanted to share it with you. And also, I thought that picture of me was particularly attractive. So before I kind of move on a wee bit more, I wanted to get you to look at other resources, because if it's worth saying, it's probably been written by somebody else. So this has. 3 years ago now, this chap, Frank McHenry, he's a local photographer, an excellent local photographer, and he does social portraits and pictures. And he did a exploration of Annam's work. And you can watch that on YouTube. And he recreates some of the pathways, and he walks around Glasgow and shows where some of the images were taken and what significance they have. We're going to do the same thing as I walk you through historic Glasgow, but his is better. So I wanted to get you to be aware of it and have a look at it. Because, as Frank himself says, that in 1866, Glasgow was so overcrowded, it was so struggling under the burden of disease and the sheer influx of people and the poverty that separated the city, that Parliament was forced to take action. Now, we'll come to discuss about the fact that there's been questions whether that's true or not, and whether or not Annam himself took it upon himself to walk out into the streets and start taking pictures. And we're still trying to work that out. I do find it quite interesting that if Annam did take it on himself and go out into the streets and take pictures of people, that makes him revolutionary. When I do it, I'm weird. But what's interesting about his work is it shows there's a kind of shift over change. So I would encourage you to have a look at it, and it was a nice way to show you some of the wider images that don't fit into the old, close images. So Frederick Engels obviously talked about the issue of poverty and disease and squalor that Britain was going through. This is the high point of the British Empire. 1844, we're about 10 years away from the British Empire stamping down in India, taking control of the Raj through force. You have expansions into 2/3 of the globe. This is a period where Britain has industrialization and is based on manufacturing, is one of the powerhouses of the world. And as we now know, as we're now discussing, this is a legacy built on blood, which is a difficult conversation. Fortunately, I don't have to talk about it. What I can talk about is the issues closer to home, and the issue of the fact that Glasgow, being the second city of empire, was by far one of the worst, and even outstripped London. We talk about London, we talk about the huge health reforms, John Snow's Broad Street Pump, recognition of cholera being spread through water. We talk about Joseph Balgazetti's sewer system creating a brand new way to get the refuge out of the city and bring the clean water in, to completely change the way that the public health worked. We tend to talk about how the Thames became recognised as this just vile, villainous place that would kill anyone who was around it. But Glasgow was right behind it and doesn't receive the same amount of attention, at least not from historians. Engels came for a visit. He said he visited the Wines, the back streets of Glasgow, and he saw so much filth, crime, and misery and disease that he found it hard to believe. In later speeches and later writings, Engels compared it to needing the same level of attention as a civilizing mission in India did. Now that's a sentence that's filled with issue in itself. But if you take into account the colonial mindset of the time, and then to make comparisons between what was supposed to be the biggest industrial city in Scotland, the second biggest of the British Empire, and he's comparing it to the places that the British military are supposed to be out helping and saving, it brings it just into kind of clear reflection just to what extent they felt Glasgow was rife. One of the more unique things about Glasgow, as we know, is where the houses, the tenements are built on top of each other and how close people are living together. You've got, he said here, like the center of the housing court is a dunghill. The houses, mostly 3 or 4 stories high, are built, which is probably the most lucrative part of the estate, which I thought was a bit mean. And most importantly, you've got this point underneath about, in the lower lodging houses, 10 to 12, sometimes 20 people of both sexes, all ages, sleep promiscuously on the floor in different degrees of nakedness. These places are generally as regard dirt, damp, decay, such as no person of common humanity would stable his horse in. Now, there's a lot to unpick from that. Firstly, we've got the idea about just how bad was public health spaces within the private sphere, because we tend to talk about the public sphere, we talk about the drainage systems, we talk about the streets. And you can see that from the picture. And Thomas Adam grabbed these pictures and you showed people crowded into an area. You've got washing over to one side. You've got, here is a kind of pump where they would possibly wash and or drink from. And then you've got the drainage system, which is this gutter here, all in the same place. But you made the comments that Engels was making about the 10 to 12, sometimes 20 people of both sexes and all ages sleep promiscuously on the floor in different degrees of nakedness. It dehumanizes these individuals. They're not people. That's the way you would describe animals. People who are less than you would perhaps consider. And that's very much the kind of way that these kind of areas were seen, because we've got this significant class divide. So let me take you to Glasgow. This is 1901, so I'm cheating slightly. But let me take you to its peak. And you can see that if you swap the horses out for cars, and you swap out the signs for these new low emission zone posters, it's more or less the same place. Very, very busy. There's people everywhere. It's a hub of commerce, and you've got thousands of people kind of tripping all over each other. By 1821, the census showed that Glasgow's population had overtaken Edinburgh. And you get this huge divide, particularly by the 1880s, with the very rich and the very poor. Does anybody know the big theory about why the West is the rich one and the East is not? The wind, that's it. It's just, I mean, it's as simple as that. No, it's very much the wind. And I always think that's interesting with undergrad students, that they just find that really hard to believe, that the wind could be such a factor in whether someone's going to live for 12 years longer than someone somewhere else, a mile down the road, because the wind is in a different direction. Like that blows their mind. No pun intended. So, by the end of the 19th century, there's this belief that Glasgow is one of the best governed cities in the world. It's one of the most prosperous. You've got new works of art, you've got these beautiful buildings being erected, and you've got heavy industry, as you said. You know, from after the 1830s, you've got Glasgow developing as the major centre for heavy industry. You've got the hot blast, which is where they kind of open these rich black band deposits of Lanarkshire and start to produce really cheap pig iron. So they get to be producing more, selling more cheaply. You get the Monkland Canal, which gives easy routes in and out of the city. And most of the entrepreneurs, your old artisans, after the kind of rise of the working from the feudalist process, agrarian, through to kind of the Industrial Revolution, they start moving from textiles to iron founding and engineering. And all of that brings dirt, dust, occupational health issues. Not that they would know yet. And then from the 1820s, you've got steam power, you've got shipbuilding, which whenever I give a talk on Glasgow's history and say shipbuilding, people kind of groan. And then I tend to give them 10 seconds of, oh, you know, it's so sad it's gone now, which it is. But by 1830, Glasgow is renowned for inventing new technology to create bigger ships, faster ships. Of course, one of the issues with bigger and faster ships is to carry more people. More people come here, more people bring disease. If you can get from one place to another faster, then that disease has got more chance of getting here. Best example I can give you is cocaine. But if you think about the fact that cocaine didn't take hold in the UK until the late 19th century, the reason for that has got nothing to do with morality, sensibility, or technology, except for the fact that cocaine was only able to be salvaged and kept alive is the wrong word, but kept fit enough, I've lost the word, to bring it over and process it. If you then add that to Nielsen's work in Germany in the 1880s, you then get a substance that you can import fast enough before it rots and a chemical process that allows you to create it, which creates the cocaine boom from 1880 to about 1912. 1916 if we count the war. We've got tons of engineering, we've got tons of work, and you've got a huge amount of people moving in to Glasgow. I've already said that by 1820, Glasgow becomes is the most populated city. Right? It's overpassed Edinburgh. And people move for various reasons. We've got the Highland clearances, where individuals have moved from their land and moved into having to find work in the cities. We've got individuals who realize that they just can't maintain an agrarian lifestyle anymore. They can't do agriculture. They've got to move into work in factories, and it changes their entire lives. What comes with that is that the city doesn't miraculously get bigger. We just have to fit more people in. So one of the ways to test this, unfortunately, is to test the deaths per population. So deaths per 1,000 population, 1855 to 2021. If we follow through, in 1855, you'll see that you're looking at deaths around 30 per 1,000, which is really high. And we'll come to the reason for that. But as you run through the next 20 years, it continues to spike. I mean, there are ups and downs, there always are, but it continues to spike. And this is across the board. You're looking at high infant mortality rates. You're looking at male life expectancy being particularly low. Heavy industry, plus dirt, plus disease, plus a lack of public health initiative leads to a city where its inhabitants are dying. So, in 1866, the City of Glasgow passed an act through Parliament which authorised it to destroy the disease-ridden sums of the city parish. This is the point where Annam kind of steps back into the equation. Because it's been known for a while that there are key areas in Glasgow that you just don't go because they are synonymous with crime, with ill health, and these are the areas that they decide to get rid of. So they're going to destroy all of these buildings and they're going to build new ones. Everything's going to be hunky-dory. But there's an outcry against it because of destruction of these are people's homes. There's also an element of culture. It's very easy for me to sit here and poke holes and tell you how terrible it was to live in Glasgow in the 1860s, but I'm not telling you about the music and the stories and the love and the paintings and the writings that some people did and the things that they passed on to each other as they lived in these close quarters, but they lived. best way to give you a bad example would be watch Titanic. Look how bored they are in first class, right? Same thing. So they decided to change them, and they started to create these kind of made down houses. And each room within the dwelling was used as a separate house, frequently separated by insubstantial partitions. And to get into those buildings, they would have a brick-built staircase tacked to the back of the building. You're taking a pre-purpose building, separating it up and shoving people into it. And this is what Thomas Annam actually captured. And we can see, here's Close Number 80, High Street. It's one of the most famous pictures that Annam ever took. You'll see this a lot. You've got Close, they're called Closes. Number 46, you've got a range of children sitting next to like broken walls, and some people are, the people at the back are actually finished a work shift, if I remember rightly about this particular picture. The point here is that you've got a lot of people just living in very kind of dark, dank areas, spreading disease amongst themselves. So keep these images in your mind. Keep trying to imagine what it was like to be in there, and think about the fact that between 1830 and 1914, you've got havoc wreaked on the individuals of Glasgow, particularly the lowest classes. These overcrowded, damp tenement houses encourage tuberculosis and rheumatoid diseases. Respiratory illness increases, heavy industries created smoke and fog in the air. And one of the big things here is the epidemics. It's easier to talk about epidemics now in many ways because we understand it, I think, a little bit better. If 5 years ago, when I was trying to get people to understand the influenza pandemic, or the cholera pandemic, or the plague, I'd be like, oh, that's nice. But now, having lived through one, and we've seen just how much damage it can do, and we saw that with the benefit of 21st century technology, where when we were trapped in our houses, we could use magic boxes to talk to our loved ones. Or I used mine to not talk to them. Netflix is epic. But you get the point. They had none of this. These are these dark, dank, horrible rooms, often without windows, usually not clean, and in cases of epidemics, in some cases, to be locked inside them. The first cholera epidemic is in 1832. Sunderland actually gets the prize for the first cholera epidemic. I'm from Sunderland. It's nice for us to be proud of something. We've got cholera and shipbuilding. We had cholera and shipbuilding. But so in 1832, it becomes a particular alarm to the middle classes, as the cholera epidemic strikes all the way through, and it doesn't seem to recognise class barriers, which is very rude if you're middle and upper class, to have a disease that doesn't limit itself to the poor people. Measles, scarlet fever, and diphtheria, killer diseases in the malnourished and rickety children. Because if we go back to the disease and squalor that we're looking at, we're also looking at large-scale families. Individuals would have upwards of 9 children above, which meant cramped conditions, malnourishment, and often death. In 1845, you get the Poor Law. It made rudimentary provisions for the destitute and the sick. And in 1859, the health of Glasgow changes quite significantly because they start to bring in water from Loch Katrine. This is worth noting because it's a bigger step forward than Jon Snow. Jon Snow, the Broad Street Pump, and so forth. I don't think the Game of Thrones thing's still hanging over us, but for anyone who's confused, you've got a public health initiative which, not overnight, but in a couple of months, changes the dynamic of people's lives, simply because they have clean water to drink. But even more important than that are the medical officers of health. You've got J.B. Russell and W.K. Chalmers, who they create public and civic awareness of shortcomings in public health and social conditions. This is a period where you get chaps like the Roundtree Foundation, who's wandering around saying everything's terrible, we should do something about it. You've got Bernardo's talking about the rights, the wellness of children. This is a period where we come to almost to the end of the kind of privileged upper middle class responsibility, the noblesse oblige to care for those less fortunate, as we move into a period where public health becomes the purview of the government. And we all know how much we like to give power to the government. So it isn't responded very well, particularly from those who are going to have to pay for it. But the philanthropic activities in Glasgow rose dramatically from the mid-19th century as those with wealth, and there were many, began to take responsibility for those who didn't. But it doesn't change the fact that you're in a period where it doesn't matter which class you're in, but particularly for the lower working class, you get to choose your fate. Do you die from epidemic and contagious diseases, respiratory diseases, and venereal sexual health diseases? Now, I wasn't sure if I was allowed to talk about syphilis, so I've not. But if anybody wants to talk to me about it afterwards, wait, that sounds really weird. No, I just wanted to put that up and say that this is a key problem, and it goes with morality, and it goes with the issues of promiscuity. I mean, we saw the word promiscuity in Engels' talk, but Engels wasn't directly talking about sexual activity. What we are going to talk about is tuberculosis. So in the 1830s, there's this tendency to see any form of disease as an act of God. So this is another issue in terms of, science is progressing, but a disease can have an impact where, if to tamper with it, are we tampering with the will of God? This is a period where religion still has a very strong hold. By the 1840s, campaigns are starting to push that the human intervention was necessary to tackle the worst considerations. The pessimists amongst us may say that the reason for this significant push is because you need significantly more factory workers than you do farm workers. So if you need capitalism to maintain itself, then you need workers. It goes around the same kind of lines about why would you abolish slavery? Because you need people to have money. There's two ways of looking at it. In Glasgow, the town council took the lead and started to remove middens and dung heaps, which is where people would dump their waste, as they were seen as a new source of infection. And we've talked about Loch Katrine. In 1862, Glasgow took a huge kind of step forward by appointing medical officers of health, and they started to tear down these horrible slums in 1866. But tuberculosis still continued to be they continued to be a disease that they weren't entirely sure where it came from, weren't sure why people had it. And as I found out recently, tuberculosis was also seen as quite a fashionable disease. Like, it was a weight loss cure. Yeah, so they would use it as a weight loss thing. This is why we've got this kind of picture of this woman, and they've got the angel of death kind of hanging over her. The point is that some people would actively seek out tuberculosis. It's one of the stories. You probably know tuberculosis better by this term consumption. In many cases, the best way to deal with it was to remove someone from the source of their infection and move them into somewhere with cleaner air and allow them to recover. One of the things I found quite interesting about tuberculosis is the fact that corsets, I don't know if you can see this, it's not very clear, but if you think about women's fashion from this time period, the corsets would push their internal organs upwards, which would make them so much less effective. So you can see that practically everything's been pushed up towards the sternum, which would significantly reduce the respiratory capability, apparently, and then make them more likely to contract tuberculosis. I had no idea about that. The other thing about tuberculosis is it's still a huge thing today. I'm talking about it as though it doesn't exist, but my sister runs the TB centre for the Northeast. Like, I didn't think we needed it. I thought she was just skiving. But apparently it's a real job. So, and you can see why in places like this, the tuberculosis would just sweep through. TB unaccounted for somewhere in the region of 12,000 deaths each year from 1900 to 1910. This is 20 years after they really start to get a handle on understanding that sanitation and hygiene needs to be controlled. Conservative estimates say that between 1 and 12 people suffered TB in Glasgow in that period. One of the ways that they started to kind of change this is they start to open up the West End. So you can see from the map here, this is Robert Perry's map that was designed in 1870? Yeah. And it was all about where the most kind of areas of contagion were. The different colours denote where you've got the bigger issues. Pink tends to show that these kind of areas had more TB than others. When they started to build the West End, it was very useful getting the rich out of the danger area. You move them towards the west, you get places like the relocation of the Botanic Gardens to Kelvinside in the 1840s. You got relocation of Glasgow University to Gilmore in the 1870s, and a lot of people kind of still follow, which leaves vacant places in the main city of Glasgow to build green space. So small parks and so forth, which had a really good impact. If you're looking for an example, you could look at Bellahouston Park, which is a good example of an area that's in quite a deprived space. Going back to Thomas Annan's pictures, you'll have seen, like, again, we're back to the close, we're back to an area, and I've made it all very doom and gloom. Everybody died, go home, right? But this isn't the full story. Glasgow is a pioneer in so many different ways. One of the ways that I think is important but never gets talked about is the fact that Glasgow formed the first city constabulary in 1800, the first kind of unifying city police force. And you can see them there, very happy to start working on Sucky Hall Street, getting in those retrobates. Point here is that we had a police policing force that became a key component of the public health process. Not always in a good way, but in a strong way. You've got the Scottish Registration Act of 1855. So the Registration Act relates to knowing the census, who is in Glasgow and how many people are dying. It's an incredibly useful tool because up to that point you're estimating numbers, and it's very easy to fudge numbers, forget numbers, or not recognise where people are ill or health. Annan creates a picture of this, but the statistics show you an actual story. In 1863, Scotland produces the Vaccination Act. Some of you will know that in England, the mandatory vaccination comes in 1856. 1853 and 1856, you get this mandatory vaccination. Scotland, because of the way its health systems are set up, refuses to follow the same pathway. And it creates a significant change between, I'm going to go back a slide in a second, but it creates a significant change between the way that the smallpox vaccination developed by Jenner is rolled out in Scotland and that is in England. Because in England, almost immediately, there is a huge pushback against it. But in Scotland, the Scottish system is supported by the physicians of Edinburgh, and they detached the vaccination from the Poor Law, which removed a lot of negative stigma, according to it. They also did very well to control all the information that came out regarding the vaccination. And this led to the uptake for the smallpox vaccine being much more successful. Very quickly, it's important for you to remember the kind of progress of medical timeline in this period. And this isn't all connected to Glasgow, but Glasgow benefits from it. And we've talked about Jenner. You've got the successful transfusion of human blood, the development of the syringe. Joseph Lister creates antisecondary principles in 1867. Pasteur and Koch, these are your kind of key names in the history of medicine because they discover the origins of where disease is coming from. And once we have that level of understanding, this is the bacteriological revolution, this allows for new ways to tackle disease. No longer are you focused on just Jenner's vaccination and tea leaves. We're now developing vaccines for typhoid and plague. The plague one didn't work particularly well. Anthrax, rabies, as well as understanding blood groups. This is a period of significant discovery in Glasgow. Adjust to this very quickly. Swapping to the other side, because I don't want to focus on vaccination too much because it's all downstairs. But something that I find particularly interesting is the amount of people, is the way that people resisted to it and the way that they were punished. for not engaging with this public health element. Now, Annan's photos show us that one of the biggest issues that they were all living together. We now know that this was a period of trying to change that, and his images changed public perception and showed that it wasn't just that they were lazy or that they were criminals and so on and so forth, that there was an actual issue. The focus on clean water and a better understanding of medicalization allowed us to have new practices of sanitation. Vaccination is the other story here, where it talks about the way that individuals could be punished if they didn't vaccinate. This particular chap, 1893, wrote a letter, and he said that he refused now 3 times to have his 5-year-old vaccinated. And the reason for this was that he decided there was an issue with the physical risk. Now, it's very easy to sit here and go, well, you should have got your kid vaccinated. But the point that he was making is that the success of Glasgow and Scotland, indeed, vaccination process from the 1850s onwards was so good that smallpox was not eradicated, but it was really, really low chance, even towards the end of the 19th century. If you add to that the fact that there were over 3 million deaths from smallpox in the 20th century, that shows how well Scotland had been doing. Scotland had taken something which was the scourge of practically the whole population and had remarkably kind of beaten it. It's one of the only diseases we've ever beaten, according to the World Health Organization in the 1970s. The point here is, at this point, Glasgow's vaccination effort was so strong that having the vaccination actually meant that you were more likely to experience the side effects that could potentially spread smallpox or make you ill. So, as weird as this is actually a compliment towards the public health initiative of Glasgow. What you've got here is various different images of Glasgow then and now. You've got a period of significant social, medical, technological, political change where we have changes in new technologies, we've got new ways of understanding sanitation, we've got new ways of protecting individuals, and you've got a huge shift towards the political responsibility for citizen health in a way before. And Glasgow leads the charge on this in a way that many other cities don't. The laissez-faire attitude that still maintains until the 1930s elsewhere, Glasgow is ahead of, to take care of its citizens, to get rid of the slums. And at the centerpiece of all of that is Annam's pictures, because he presented an actual image, a way to understand that was so much more visceral than a chat in Parliament or over a glass of whiskey. So I'm not saying that Annan is the reason that Glasgow has a public health upswing, is the reason that Glasgow changes, but I am saying that he's a huge part of that. And his social photography is one of the more powerful vehicles to push social progression, I would say, in British history.